Okay, let's talk about anatomical regions. The anatomical regions are just different regions of the body, just different areas of the body. Now, in anatomy and medicine, we use a very specific terminology or set of words to describe the different areas of parts of the body. And those terms that we use in anatomy and medicine are very different than what you might use in sort of your normal everyday language, right? So I'm going to pop up a picture now and you can pause this video if you want so that you can look at all the different anatomical regions. But let's take a moment and go over them using a 3D model. We're going to use this 3D model here in Sketchfab, and the link to this model is in the video description. So I'm just going to go ahead and we're going to zoom in and we are going to do this sort of region by region. Right? And so we're going to start with the head and the face. So here, the forehead, this is going to be your frontal region. So frontal is forehead, think frontal bone. That's where the frontal bone is. This is the frontal region. Here we have the orbital region. The orbital region is the region around the eye. It is around the eye. The eye itself is the ocular region. So orbital, around the eye, that's the orbit. Ocular, think oculi, eye, that's the eye. So orbital around the eye, ocular, the eye itself. You have the nasal region, that's going to be your nose. The zygomatic region, that is like your cheekbone right here, okay? And then if we turn this sort of sideways, right, and look at a lateral view, this is the buccal region. The cheek is the buccal region. Right? Around the mouth, this is the oral region. So the mouth is the oral region. And then your chin here, this is the mental region. Chin is the mental region. So the mandible up this way, right, sort of inferior or below the cheek, this is the mandibular region. So mandibular, buccal, zygomatic, ocular, or sorry, orbital, ocular, frontal, nasal, oral, mental. Now, if we come to the side here, we look at a more lateral view, right? Here's our buccal region, our mandibular region, zygomatic up here, right? This is the temporal region. The temporal region, think of your temple. Up here, we have the parietal region. This is where the parietal bone is. So parietal, temporal, and then you have the fleshy part of your ear is known as the auricle. So this is the auricular, Auricular. So auricular. And then the ear itself, sort of where the ear canal is, we'll call that the otic region. Right? We look at a posterior view or sort of look at the backside of the head. This is going to be the occipital region. So the big portion of the back of the head, this is the occipital region. And then right here where it sort of like dips in, it's going to sort of go like this and dip in, right? You can sort of see this on the backside where it comes in and dips in. This is going to be the nuchal region. So nuchal, occipital, parietal, temporal, auricular, otic, zygomatic, buccal, mandibular, right? Now, if we look at the neck, right, just the neck portion, this is known as the cervical region. This is the cervical region. Both the anterior and posterior aspects are the cervical region. Okay, so as we come down into our shoulders here, we have the deltoid region. So the top of the shoulder, the superior aspect of the shoulder. This is the deltoid region. It's where the deltoid muscle is. The armpit is the axillary region. So axillary, deltoid. Okay, the chest here, the whole chest, right? This is known as the thoracic region. The whole chest is your thoracic region. Each sort of side, this is a pectoral region. This whole thing is the pectoral region. In the middle where the sternum is, this is the sternal region. So sternal, pectoral, deltoid, axillary, and then where the breast tissue is, the mammary tissue, that's known as the mammary region. So the mammary region is almost like a subset of the pectoral region. So mammary, pectoral, sternal, deltoid, axillary. All right, let's zoom out a little bit. Go move this way and let's look at the upper limb or the arm, right? So we still have the deltoid region, the axillary region. So deltoid be the shoulder, axillary be the armpit. Here we have the brachium or the brachial region. So both anterior and posterior. So where biceps and triceps are, that's going to be the brachial region. The elbow, the anterior aspect of the elbow, the inside portion, right? That is going to be the antecubital region. The backside or posterior aspect of the elbow here, this is known as the cubital region. So you have cubital and then antecubital. Some people will refer to this posterior aspect of the elbow back here. They'll call that the olecranon region because it's where the olecranon process of the ulna is. So but we'll call it the cubital. Okay, then we have the antebrachium, which is going to be your forearm, both anterior and posterior aspects. The carpal region, that is the wrist. The whole hand, that's going to be known as the manus. So whole hand is manus. Then you have the palmar region, which is the palm of the hand, and then the dorsum of the hand, which is the dorsal aspect of the hand. The metacarpal is sort of like the hand itself, and then the phalangeal region are the digits or the phalanges. Okay, so we have deltoid, axillary, brachial, antecubital, cubital, antebrachial, carpal, metacarpal, phalanges. All right. Now, if we look at sort of the trunk or the torso, we are going to have the abdominopelvic region. This is the abdominopelvic region, abdominal here, pelvic down here. This sort of midsection right here will cross the belly button. This is the umbilical region because the belly button is also known as the umbilicus. Okay, then you have the inguinal region, which is the groin itself, and then you can have the gonadal region, where the gonads are, especially if this is going to be a male, which has external genitalia. Okay, and then you have the pubic or the genital region for the genitals itself. Flip this around. Let's go to the posterior aspect. Okay, now we have on the back side, we have the scapular region where the scapula is. Okay, then in sort of the middle, we have the cervical region, that's our neck. Then we have the thoracic region of the vertebral column, so thoracic region. Then down here, you have the lumbar region. So this down here on the backside, this is known as the lumbar region. And then you have the sacral region where the sacrum is. Look at the buttocks. We have the gluteal region. So the gluteal is the buttocks region. Okay, and then you have the anal region, which is where the anus is, and then between the anal region and genital region, you will have the perineum. Now, we move to the lower limb. We have the femoral region where the femur is. Anterior, posterior, doesn't matter, all the femoral region. On the anterior aspect, when we get down here, your knee, right? The anterior or front side of your knee where the kneecap is, this is the patellar region. It's where the patella is. On the back side or posterior side, this is the popliteal region. So gluteal, femoral, popliteal. On the lower side of the limb or the inferior aspect or distal portion of the lower limb, your shin anterior aspect, this is known as the crural region. Shin is crural. On the back side, the calf, this is known as the sural region. So sural here, curl here, curl, sural, patellar, popliteal, femoral up here. Now we go down a little bit. We have the tarsal region. This is where the ankle bones are going to be. The heel is known as the calcaneal region. That's where the calcaneus, the bone is. Right. Then you have the plantar region, which is the bottom side of the foot, the sole of the foot. You have the dorsum of the foot, which is the top side of the foot. So if we look at the lower limb here, right, you have femoral region, patellar, popliteal, crural, sural, tarsal, calcaneal, plantar, dorsum of the foot. Okay, the whole foot itself is known as the pedis region or pedis region, which means foot. Okay, and those are the anatomical regions. Make sure you take time to study those and learn those because those are the regions that we'll use later on. And we'll use that to describe every region of the body when we get there. And we're going to use these pretty consistently and frequently. Later.